Yes, I'm here today because I'm not happy with my eyes. I feel like I always look tired and I have fullness under my eyes, and I didn't know what you recommend for that.
That is one of the most common questions that we get asked. And what people complain about is the shadowing effect that they see in their lower eyelid. And that is caused by two different things. One is a true physical shadow, because you have some of this, a little bit of extra fat in the lower eyelid, and it sticks out a bit and it causes a true shadow. The other thing is, as we age, you get some thinning of this skin, and you can see more of the venous blood in that lower eyelid skin, and it looks dark or blue. So both of those things contribute to the shadowing effect in this area. And what we can do to help you is to do a lower eyelid procedure, or a blepharoplasty, which is an incision right under your lash line of your lower eyelid. Remove some of the skin, remove some of the fat, and tighten this up. That will improve the lower eyelid appearance dramatically for you because of the true physical shadow effect that you're getting. Now, some of the blue may persist, and the blue color, because of the thin skin, we cannot always correct.
Okay.
But in the vast majority of people, you can get a very noticeable improvement by tightening the skin. So that's a lower blepharoplasty. And I think you would benefit from that. And it's a short operation, takes less than an hour, can be done under sedation with local anesthesia. My preference is a general anesthetic, but it is about a 40-minute operation. Outpatient, so you go home that day. You have some bruising and swelling for 7 to 10 days on average. It can be a little bit longer if you tend to bruise more than some people.
Well, do you recommend, if while you're there for the lowers, do you recommend also getting your upper eyelids done?
Well, we have to look at that, and that's commonly done, an upper blepharoplasty, which is the upper eyelid. And you do have some extra skin in that upper lid. The incision is the same. We make it in the eyelid crease. It does extend laterally a little bit more than the lower. We remove some of the skin. But when we do the upper eyelid, we also have to look at your brow position, because they're intimately involved with each other. And sometimes if all you do is to remove the eyelid skin, you actually pull the brow down. And some people, you need to do a brow lift first.
Oh, okay.
So depends on the exam of each patient. You in particular would just need maybe just the upper eyelid procedure. But as we age, our brow tends to want to fall down, which in a man looks appropriate. But in women, it looks better to have your brow higher, above the bony rim of your eye, so it should be up here. And you have to judge the location of the brow before you do the eyelid procedure. And sometimes we do both, a brow lift with an upper blepharoplasty, and it can be done endoscopically, which is the most common way to do a brow lift today. Make an incision in your scalp on both sides, about a ½ inch in length. We don't have to shave the hair or anything, so that's nice. You don't have to wait for your hair to grow back. And through those incisions, we use a small version of an endoscope. We look under the skin of the brow and free this up and pull this back up and place it where we want it. And that's the brow lift. Again, that is also an outpatient procedure. It takes about 45 minutes to do a brow lift. And we commonly do that with upper eyelids and lower eyelid procedures all at one time. So it depends on each patient. Like with you, it might just be upper eyelids and lower eyelids. But commonly we do brow lift, upper and lower eyelids.
Great, thank you.